Why does my child still wet the bed? Find out today on the Breathing Wellness vlog. Welcome to the Breathing Wellness vlog, a weekly video response to some of your questions about breathing, sleeping, and living a pain-free life. This week's question is, why does my child still wet the bed? First, let's talk about normal versus abnormal bedwetting. If your child is 5 or younger, they are still considered to be in the normal potty training age range, where accidents are just a common part of childhood. However, according to the National Sleep Foundation, if your child is over the age of 5 and they are still wetting the bed more than 2 to 3 times per month, it's something you should probably consult a doctor about. One cause of bedwetting, and one we see pretty often, is early onset sleep apnea in young children, in some cases as young as toddlers. Here's a quote from the Mayo Clinic. Sometimes bedwetting is a sign of obstructive sleep apnea, a condition in which the child's breathing is interrupted during sleep. It stands to reason that if our basic fundamental need for oxygen is abnormal, the brain starts stealing oxygen from the body, and the first organ that the brain goes to is the bladder. This robbing of oxygen triggers a releasing of the bladder, resulting in bedwetting. If your child has sleep apnea, they're likely exhibiting other symptoms, such as trouble sleeping, headaches, daytime drowsiness, and other issues. The good news is, the earlier you address sleep apnea, the better. Click on the link below to schedule a free evaluation with our sleep specialists to see how we can help your child breathe better, sleep better, and eliminate bedwetting for good. I hope you found this video useful. We'll see you next time.